Hello, my name is Dennis Scanlon, and I'm Director of the Center for Healthcare Policy and Research at Penn State University. Thank you for joining us today for our second edition of Ask the Experts, which is our informal conversation with experts across the Commonwealth of Pennsylvania and across the country on topics important for our healthcare industry and improving healthcare today. And I'm pleased to be joined today by Dr. Keith Kanel, who's a physician and the Chief Medical Director at the Pittsburgh Regional Health Initiative in Pittsburgh, Pennsylvania. Keith is an internist, heavily involved in a lot of projects for PRHI, as well as around the Commonwealth and around the nation. And we're happy to have him join us today to talk about issues such as transparency in healthcare, delivery system redesign, and payment reform, to name a few. So Keith, welcome and thanks for joining us today.
Thank you, Dennis. Delighted to be here.
Great. So before we get started on those topics, maybe you could tell us a little bit about PRHI, the Pittsburgh Regional Health Initiative, and the work that you do there.
Oh, happy to. Pittsburgh Regional Health Initiative is something called a Regional Health Improvement Collaborative. We're a not-for-profit. We're located in downtown Pittsburgh. We were actually founded by the business community and the regional hospitals. We're looking for a neutral convener that could help establish a roundtable for innovation that occur in this region so that we could stay innovative and stay progressive. Our portfolio of work right now extends from readmission reduction projects to integrating behavioral health and primary care settings. We work in long-term care. We're very deeply involved in primary care transformation. In short, we try to work on the gamut of healthcare problems that might be relevant to Western Pennsylvania.
You know, Keith, as you know, I've been involved in studying a lot of these neutral conveners and collaborators across the country, and so I always like to take the opportunity to ask those that are doing this work on the ground. You know, maybe the question I want to ask is, you know, what's the secret sauce of kind of making this work? Healthcare is a very competitive industry. There's been lots of consolidation. There's lots of dollars at stake in healthcare. We've got different delivery systems and organizations that compete. So how do you take a very competitive environment, but yet act as a neutral convener and get people to collaborate on, I guess, ultimately what we might call the public good of making things better for everyone?
You know, one time it was said that our secret to success was staying below the radar. But I think that's actually not the case. I think our secret is being above the radar. We really try to strike noble goals. And we find that most people, even in the most competitive settings, really enjoy collaborating when they can. We're so much stronger when we work together. And believe it or not, in our health systems and in our health plans, we are incredibly successful at getting them to work together when we try to maintain a fair, even process with fair process in all aspects.